Good evening. I'm psychiatrist Jay Fauver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 27th year, Matters of the Mind is a live call-in program where you have the chance to call directly here in the Fort Wayne studios by dialing in the Fort Wayne area at 969-2720, or if you're calling coast to coast, you may dial toll-free at 866-969-2720. On a fairly regular basis, we are broadcasting live from our spectacular PBS Fort Wayne's Bruce Haynes studio right here in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. That's Matters of the Mind at WFWA.org. And I'll start tonight's program with a question I recently received. It reads, Dear Dr. Fauver, my workplace offers 6 free sessions for mental health counseling. Should I try to space them out or use them all at one time? It really depends. If you're having some specific problems that you want to address sooner rather than later, such as interpersonal problems, difficulty with coworkers, difficulty with administration or management, especially within the workplace, you might want to address that sooner rather than later and maybe have weekly sessions to try to get through some of those initial problems. However, if you just want to check in every now and then, you could maybe spread those sessions out if you don't have any particular concerns in mind for the time being. You could maybe just do a mental health check-in every few weeks or every few months for that matter and use those 6 sessions in that manner. Thanks for your email question. Let's go to our first caller. Hello, Dylan. Welcome to Matters of the Mind. Well, Dylan, you want to know, when does bipolar disorder start to manifest itself in a person, and what are the signs? It usually will typically occur with depressive episodes early on, and it might occur as early as in the adolescent years, and it typically will affect men equally in prevalence to women. The early signs can be decreased need for sleep, impulsivity, saying things and doing things you ordinarily wouldn't say or do. You might talk really fast and go topic to topic to topic, and those are some of the symptoms of mania. And of course, people can then crash into lows, but not everybody crashes into lows, but most people do. Now, typically, you know you have bipolar disorder if you have those kind of symptoms, especially if you have family members who have experienced similar symptoms, and they have bipolar disorder as well, because bipolar disorder is considered to be 65% genetic. So there's a genetic link there, and if you have those symptoms, typically they're going to occur late adolescence or early 20s for most people. Rarely do I ever hear about bipolar disorder having its onset in the 40s or 50s. If that's occurring, I'm always looking for other type of conditions. For women, for instance, maybe they're having moodiness related to menopausal challenges. For men, maybe they're having moodiness due to their drinking. Maybe they have sleep apnea. There might be something going on if you have the onset of those symptoms in the later years. But usually bipolar disorder has its onset in the adolescent years or in the early 20s. Thanks for your call. Let's go to our next caller. Hello, Britt. Welcome to Matters of the Mind. Britt, you'd mentioned you forgot your anxiety medication, which was Zoloft, on vacation for a week. Could you pick up your normal dosage as a backup and contact your clinician and make sure that the clinician's on board with what you're doing? Typically, if you were taking 50 milligrams or less on Zoloft, you could pick it right up and take 50 milligrams. If you were taking 100 milligrams or even 200 milligrams of Zoloft, you might want to start with a lower dosage and slowly go up. Why? Because there's a possibility you might have some diarrhea and some gastrointestinal problems if you start on a higher dosage right off the bat. But you can always talk it over with your clinician, just being aware that a higher dosage will be more associated with more side effects. Thanks for your call, Brett. Let's go to our next caller. Hello, Bain. Welcome to Matters of the Mind. Bain, you want to know if long-term lithium treatment causes brain damage. You'd have to be at really toxic levels, Bain, for you to get brain damage from lithium. Lithium, if anything, is beneficial for the brain. As a matter of fact, we've got these little caps on the end of our chromosomes called telomeres. And it's been identified that lithium at low dosages can actually increase the length of telomeres, which actually is good for the brain, and it increases longevity. So low-dose lithium is actually good for the brain and the rest of the body in a lot of ways, but you have to be very careful with the dosing because it can cause hair loss, thyroid disturbances, and kidney problems at too high of a dosage. So you'd want to adjust lithium and be treated with lithium under medical supervision, but there's no evidence that lithium at clinically common doses will cause brain damage. Thanks for your call, Bain. Let's go to our next caller. Hello, Hannah. Welcome to Matters of the Mind. Hannah, you want to know what are the signs of obsession and when does obsession turn dangerous? Obsessions can become dangerous. You have difficulty with homicidal thoughts or suicidal thoughts that get to the point where you have a hard time turning them off. Now, by definition, obsessions will be thoughts that are so-called ego dystonic. In other words, they don't make any sense to you. So if you have thoughts that don't make any sense to you, chances are you're not going to act out on them. As a matter of fact, obsessions typically will cause you to have more anxiety and often lead to compulsions where you do things over and over and over again to try to get rid of them. But obsessions by nature are not the type of thoughts that you're going to act upon because by nature they're thoughts that are very foreign to you, and you don't want to do those, and they make you very anxious and even irritable, even experiencing them. Thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Favre, how does my doctor know what medications work well together? I am always concerned that there will be some sort of interaction that won't be good for me. That said, so far, so good. My medications seem to be working well. Well, that's fantastic. If your medications are working well, you probably don't want to make any changes at this point. But how we determine how medications are going to work together will be, number one, knowing what the drug interactions between them will be. But secondly, very importantly, the mechanisms of actions of medications. Why would we use 2 and 3 medications together? It's not unlike in the treatment of diabetes, hypertension, heart disease, asthma. These kind of conditions often will warrant the use of several medications that have different mechanisms of action. So based on the medications having different mechanisms of action, they will often work together pretty well. So how does a clinician know what to use for you particularly? Well, number one, you got to get the right diagnosis and know what's being treated. So having the right diagnosis is a good place to start. Secondly, knowing what has worked for you and what has not worked for you in the past, and having a clear understanding of the different type of medications based on their mechanisms of action that have worked for you and have maybe not worked for you. Next, we'd want to look at your family history of medication treatment responses. What medications have your family members taken and how did they do? If they did well, great. If they didn't do so well, we wouldn't want to go that direction necessarily. We'd want to look at other medications you're taking outside of mental health medications, such as medications for other medical conditions, because we want to make sure there's not going to be any interactions there. So we'll take all those in considerations. If we have genetic testing results available, that might tip the needle a little bit one way or another, because genetic testing can influence our treatment decisions. But basically, we're going to put medications together that have different mechanisms of action, and it'll make a big difference. Thanks for your call. Let's go to our next caller. Hello, Leslie. Welcome to Matters of the Mind. Leslie, you want to know where in the brain is drive created, and there are certain diseases that can affect the drive. Or off the bat, the front part of the brain is the decision-making part of the brain. If you have difficulty with motivation, initiative, getting things done, persevering on things, typically it's because this left front part of the brain, called the dorsolateral prefrontal cortex, it's underactive, and that's kind of making you not care about things so much. There is a pleasure center part of the brain right in the middle called the tegmentum. The tegmentum will spew out dopamine and give you a feel-good effect and get you all fired up about doing things, but it's got to fire up that front part of the brain to get you motivated to really do things. So when people have depression, when people have attention deficit hyperactivity disorder, often there's decreases in transmission in this left front part of the brain, and that will cause them to have difficulty getting things done, especially because they just don't have that sense of needing to get things completed overall. Leslie, thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Favre, is there such a thing as being too busy? It seems like my body shuts down. Is that my brain needing a break, or is it a physical thing? It could be. I mean, you're going to have so much bandwidth in your brain where you're going to have so much cognitive energy, and for many people, when they're working during the day, it's not uncommon they might need a little bit of a nap in the afternoon. And that actually resets. I just mentioned the dorsolateral prefrontal cortex right up here. When you nap for 20 to 30 minutes, it actually resets and re-energizes that thinking part of the brain. So you might notice that you're just wiped out after a certain number of hours of thinking really, really hard. And if you take a brief nap, it'll actually reset that part of the brain. You'll probably go into a really deep sleep during that time. It's called delta wave sleep. Non-REM sleep is another term for it, but it's where you're going to recharge that part of the brain with a brief nap. And that's how you know you just need a little bit of a break at that time. I often advise medical students at the end of the day, toward late afternoon, early evening, to try to take about a 30-minute nap if they can. If you take a nap too late in the evening, you might disrupt your sleep. And if you take a nap for longer than about 30 minutes, it can certainly disrupt your sleep at night, so you want to be careful about that. Thanks for your call. Let's go to our next caller. Hello, Adeline, and welcome to Matters of the Mind. Adeline, you want to know how can you address your stress at home so you're not turning to food for comfort? Well, people sometimes will turn to food for comfort, Adeline, because they're trying to increase their insulin level. If you increase insulin level, there will be an increased transportation of an amino acid called tryptophan from your body into your brain. And when it goes to the brain, it turns into serotonin, gives you a calming effect, gives you a feeling of bliss. So that's where many people will be stress eaters. So how can you deal with stress eating? Well, the best thing you can deal with stress eating is to divert your attention to doing something else, such as physical activity. So exercise is a remarkable way of helping you deal with stress. Resistance training, where you do weight work, is very good for a lot of people with anxiety. If you do aerobic training, where you're on the treadmill, elliptical, bicycle, that's often very good for depression. So for that reason, a lot of people will notice that if they can exercise and get physically active, that can help out as well. From a stress eating standpoint, well, the first thing you want to do is probably try to eat more protein. It's difficult to binge on protein. Protein will actually give you a satiating effect and have some good effects on hormones in your gut by the name of ghrelin and leptin. These kind of hormones affect your appetite and your cravings themselves. Proteins tends to shut that down and shut down your cravings. So that's where you can often have decreased craving with carbohydrates. Thanks for your call. Let's go to our next caller. Hello, Winifred. Well, welcome to Matters of the Mind. Winifred, you want to know, why does Adderall cause different reactions to the brain when you do not have ADHD? Well, actually, Adderall is a medication that for anybody and everybody who takes it, it's going to really blast out norepinephrine and dopamine. It's going to blast out from the firing neuron norepinephrine and dopamine, and does so in a very abrupt manner, and it also stimulates the postsynaptic or the receiving targets as well. It's something that in the immediate release version can be very potent in terms of how it affects somebody. It'll often give people energy, and it'll also give them a very brief awakening effect, and it's a good feeling for a lot of people. Here's the problem with Adderall, which is also known as mixed amphetamine salts. It's a mixture of various amphetamine salts, and in taking it, to get that energizing effect that so many people like, and many people get an appetite suppression effect with it as well, but to get that effect, you have to go higher and higher and higher. So the usual dosage of Adderall extended release, for instance, would be about 20 milligrams every day. I've seen people who are up to 120 milligrams a day, and they get up there quite quickly because at low doses, if you have ADHD, it can help with focus and concentration. But for many people, once they feel that energizing effect and that very strong alerting effect, they want to get that feeling again. And the only way they can get that feeling is to go higher and higher on the dosage. So the energizing feeling, the appetite suppression, the very strong alerting effect, that's a side effect. That's not the intention of using Adderall for ADHD. The intention of using Adderall or any stimulant for ADHD is to help with focus and decrease distractibility and allow you to pay attention longer and more pervasively so you can get things done. They're not for the purpose of giving you energy, but many people, once they experience that energizing effect, they want to stay on the medication and they want that good effect to be able to persist over the course of time. Thanks for your call. Let's go to our next caller. Hello, Elizabeth. Welcome to Matters of the Mind. Elizabeth, you want to know, is obsessive compulsive disorder a symptom of a bigger disorder, or can it be a single diagnosis? OCD quite commonly can be a single diagnosis. OCD is something that occurs because the processing part of the brain in the front, which tries to sort out, okay, did I think about this or not? It goes round and round. It's a circuitry in the brain. It's kind of like the old record players where the needle gets stuck and you have obsessions that you don't want to have there, and they just get stuck. and you have these thoughts, and some of them might involve contamination or harm to other people, thoughts that don't make any sense to you, and they make you anxious just having these kind of thoughts. So having OCD can be a single diagnosis. Now, there is some relationship between OCD and having strep infections as a child, because if you have strep infections, inadvertently the body will attack not only the strep, but also the front part of the brain that affects this circuitry. So a risk factor for OCD will be chronic recurrent untreated strep infections as a child. I've also heard about some women having OCD, especially after childbirth. It's kind of like a mother bear instinct, where they'll have OCD, where they are very, very obsessive about contamination to the point where it's an extreme, and they realize that it's an extreme. They're washing things dozens of times, even though they know they're clean. And that's kind of an instinctual type of phenomenon, but it becomes a problem when you do things to an extreme and it takes extra time and it gets in your way of getting other things done. Thanks for your call. Let's go to our next caller. Hello, Chris. Welcome to Matters of the Mind. Chris, you want to know, why does your doctor want you to take food with some of the antipsychotic medication? Some of the antipsychotic medication gets better absorbed with food. One's been around for a long time, for instance, ziprasidone or Geodon. If you take ziprasidone or Geodon by itself, only about half or 40% of it will get absorbed. So with some medications, you want to always take them with food. There's not just antipsychotic medications, but there's a medication used for postpartum depression called Zurzuvae. Zurzuvae has to be taken with food, especially fatty food, because if you don't take it with food, only about 40% of it gets absorbed. So with some medications, they get better absorbed if you take them with food, because they kind of piggyback on top of food and get through the stomach lining, and that's how they get absorbed. Thanks for your call. Let's go to our next caller. Hello, Crystal. Welcome to Matters of the Mind. Crystal, you want to know, how does early childhood trauma prevent brain growth, and does it affect education? You bet. Early childhood trauma, especially before the age of 8 years old, Crystal, is very important for us to assess. And there's a scale called the Adverse Childhood Experience Scale. It's 10 items that were identified as the 10 items that are most predictive of impairment as an adult if you had these kind of experiences. So Adverse Childhood Experience Scale, it's not copyrighted. It can be used for the general public, but it's thought if you had 4 or at least 4 of those different symptoms or experiences on the Adverse Childhood Experience Scale, you're more likely later on as an adult to have anxiety or depressive conditions. So early childhood disturbances can be problematic for a lot of people. So what happens, it seems to change the circuitry of the brain. So in other words, it creates a hard wiring of the brain that will cause you to have trouble with anxiety and depression at a later time. So early childhood trauma can be problematic for lots of people, and it's one of many things that can be a risk factor, but it's thought to be pretty significant with early childhood trauma, and that includes difficulty with your parents. If your parents had trouble with drugs or alcohol, if your parents got separated or divorced, these are all childhood traumas that can later on significantly affect you. Thanks for your call. Let's go to our next caller. Hello, Q. Welcome to Matters of the Mind. Q, you want to know, does long-term alcohol use cause psychosis, and is that something that will go away with treatment? Well, it can cause a lot of different things, Q. When people, especially women, drink alcohol heavily, it can fry this part of the brain called the hippocampus. The hippocampus is the memory center of the brain itself, and especially women are more prone to having difficulty with alcohol itself, because women metabolize alcohol at about 1/3 the rate as men. So 2 drinks for a woman is like 6 drinks for a man. So women's brains will be much more prone to having damaging effects from alcohol in the brain. Memory disturbances will be what we hear about the most. Psychosis sometimes, but psychosis, when we hear about that, that's more related to other drugs of abuse, such as PCP, marijuana, with high potency of cannabis. That can give you a higher likelihood of psychosis. Will it go away? Maybe. Sometimes. Sometimes people need long-term antipsychotic medications. I think it goes a lot along the lines of if you have a family history of psychosis. So if you have family members with psychotic disturbances and you use something like high-potency cannabis, yeah, you're more likely to have a psychosis that might be more long-lasting and might be more difficult to remit over the course of time. So alcohol, not as likely to cause psychosis, but it can cause significant brain damage, and sometimes that'll cause difficulty in interpreting the world around you. We'll often hear about the paranoid thoughts in alcohol use when somebody's trying to come off of it and they're in withdrawal. It's the alcohol withdrawal spectrum itself. Thanks for your call. Let's go to our next caller. Hello, Beth. Welcome to Matters of the Mind. Beth, you'd mentioned you're in perimenopause. In other words, you're still having your periods every now and then. Your ovaries are still functioning some, but you're not yet in menopause where you have an entire cessation of periods for several months. And you had mentioned you're having difficulty with multitasking or the things that you can do to help. Number one, you can talk to your clinician, your primary care clinician, about the possibility of bioidentical hormones, estrogen, progesterone, as a means of trying to steady out those menopausal symptoms, which so many women will have. If you're getting to the point where you're having symptoms of depression, we're using 2 medications now in particular for women with menopausal symptoms. Well, actually 3. Wellbutrin's one of them, Trintellix is one, and the third one is Auvelity. All 3 of these medications work differently than the traditional serotonin, norepinephrine, and dopamine-based antidepressant medications because Wellbutrin specifically does increase dopamine and norepinephrine. Trintellix increases serotonin transmission, but also indirectly increases dopamine and glutamate, whereas Auvelity is increasing glutamate transmission in such a way that they might be particularly helpful for women with menopausal symptoms with cognition itself. So what can you do? The key will be try to keep using your brain. Socialize, keep your brain active. All the type of things we ask people as they get older, as they're going into the years where they can be more prone to having dementia. Keep your brain busy. It's important to exercise your brain, just like it's important to exercise the rest of your body. Thanks for your call. Let's go to our next caller. Hello, Greg. Welcome to Matters of the Mind. Greg, you want to know if you can send messages when you sleep to help with bad dreams. It's all controversial, Greg. I've heard of some people saying that if you have good thoughts and you don't look at social media, movies, the kind of things that can create a brain environment where you're more likely to have detrimental effects on the dreams. So if you have bad dreams, the best thing to do is to think happy thoughts before you go to bed and think and look at movies or things on television, things on your computer, or read things that are going to be more favorable to having good dreams. But you can influence your dreams based on what you're reading, what you're watching before you go to bed to some degree. So that's something that can be done in a lot of cases. I'd want to know if somebody's having disturbing dreams. Okay, it can be because you're still trying to work through some things from the day. Many people will have more vivid and more intense dreams when they're sleep deprived. And it's a so-called sleep debt where they're just not getting enough sleep. They go into more intense dreams at that time. Yep, people with past trauma can have more intense dreams as well if you haven't worked those out. Thanks for your call. Let's go to our next caller. Hello, Ulissa. Welcome to Matters of Mind. Ulissa, you want to know, what does excessive screen time do to your brain? Well, I was just mentioning that, Ulissa. It can influence your mood in many different ways. They've looked at especially with adolescents and young adults, it might be affecting the way the brain is able to process information, especially if it's passive screen time and you're not highly active. It can affect the hippocampus and your ability to store memories. And we're particularly concerned about this marvelous tool called artificial intelligence. And I say it's a marvelous tool because it can do some wonderful things in terms of researching background information for you. But the problem is, you're more likely to forget what that background information was because you didn't really look it up that much. You asked AI to give it to you, and there it was. So if you have to actually work to research information, you're more likely to remember it and be part of it. It's the same type of concept where if you're asked to talk about something that you've studied or researched, you're more likely to remember it if you're asked to talk about it and teach it to other people. So with screen time, you can talk about the effect on cognition with memory and attention span, but there's also an effect from a social perspective. If you're mainly screen timing with friends and that's how you're interacting with them, you're losing a lot of social skills that you might acquire if you did so face to face. Thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions or that I can answer on the air and you'd likely write to me by email, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. I'm psychiatrist Jay Faulver, and you've been watching Matters of the Mind on PBS Fort Wayne, now available on YouTube. God willing and PBS willing, I'll be back again next week. Have a good evening. Good night.
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronHealth.com.